I wanted to add further to this. She's a brilliant creator, well worth following. Now, while PCOS isn't literally the diabetes of the ovaries, there's a strong link between the two conditions. PCOS is often associated with insulin resistance, whereby your body, if you have PCOS, doesn't respond properly to insulin, leading to elevated blood sugar levels, which is a key factor in getting type 2 diabetes. This means that women and girls with PCOS may have difficulty using insulin effectively, increasing their risk of developing type 2 diabetes, and difficulty maintaining weight or even losing weight, therefore increasing their risk of other cardiovascular problems and also impact on psychological well-being. It's important to note that not all women and girls living with PCOS will go on to develop type 2 diabetes, and the risk can vary depending on factors like your baseline weight, family history, lifestyle, how much exercise you're doing, stress, cortisol, any other health conditions. This is why the first line management for PCOS, as per the NICE guidelines, is to actually look at lifestyle and diet and exercise, as that can help improve insulin sensitivity and reduce the risk of diabetes. Sadly, we don't have a quality outcome framework when it comes to PCOS on the NHS, so we're relying on those being diagnosed to have regular follow-up and also to look at how to manage their condition. Because although PCOS is a lifelong hormonal metabolic condition, it's not just a gynecological condition, it does have overall health implications for the rest of the life for women and girls who are living with PCOS. The Royal College of Obstetrics and Gynecology has guidance that encourage anyone living with PCOS to follow up on. So if you've had the diagnosis, then you must have, regardless of what age you've been diagnosed, you must have a baseline HbA1c, blood pressure, height and weight. And then after that, be given guidance on how to follow that up. If you have fewer than 3 periods a year, so that's if you're not on birth control or contraception, and you're having few periods a year, then you must go and speak to a healthcare professional and get a ultrasound scan or a transvaginal ultrasound scan. If that's not possible, then to get an MRI to look at the lining of the womb, so the endometrium, which can thicken, and this may lead to endometrial hyperplasia, which can, if not looked at early enough, can, in a very small group of women, go on to get endometrial cancer. So PCOS has real life implications. Also, if you're living with PCOS, you need to be checked for snoring and daytime drowsiness, as that can lead to fatigue and also sleepiness during the day, your inability to concentrate, your brain fog. It's also important to be checked for mood-related symptoms such as depression and mood swings. I've actually picked up PCOS in patients who had a diagnosis of general anxiety disorder or depression, and when I've gone into their period history, I've actually realized that they probably have PCOS, and it's on a blood test or an ultrasound scan where we've actually picked up the diagnosis. So it's so important that you look at this, because those living with PCOS, it varies on how they see themselves. It can affect their self-esteem, and actually what you need to do is give them other management rather than just antidepressants. Also, if you're planning your fertility journey and you have PCOS, then it does also put you at higher risk of getting gestational diabetes, and therefore we need to manage that. I just wanted to add a little bit more to that because I thought that was really good, but also a good time to get more education and learn about that. I hope that's been helpful. If there's anything else, please do add at the bottom, and I'll take any more questions around PCOS. Thank you.